So another classification of abscess is you want to classify abscess based on what uh, the anatomy. Okay, and if anybody here knows the definition of anatomy, anatomy is simply what you're trying to look at the location, the structure of something. Okay, so for the abscesses, we say that classifying them anatomically can actually be another basis for classification. And these are the bases that we're trying to actually look at. Okay, so I think we have them on 4 slides right here. Okay, 4 slides, right? So actually look at it. Everybody knows what an abscess is, right? Abscess is just the collection of pus. All right, so pus is collecting inside the tissue. All right, and that's what we call an abscess. All right, so that abscesses can be classified anatomically, and this is based on their location and the tissue or organ that is what involved in the abscess. Okay, so here's a comprehensive classification for abscesses. Abscesses could form in the skin. That's cutaneous abscess, right? We say that examples of cutaneous abscess, we have the follicular abscess, that's around the hair follicles, or you could still say folliculitis. Abscesses due to folliculitis. The sebaceous abscess, these ones are in the sebaceous glands. There's what pilonidal abscess, this one is near the tailbone. Okay, then we have the subcutaneous what abscess. Anything you see sub, that means it is just beneath. Okay, cutaneous is skin, so subcutaneous are just beneath the skin abscess. So these ones are located beneath the skin but above the muscle though. All right, so in between the skin and the muscles. Then we have what this one could be an example of a subcutaneous. Can I say that it's just beneath the skin but what below the muscles though? All right. Then we have the muscular abscess. These ones are the ones that it could be intramuscular, that's within the muscle tissue, or intermuscular. This one is between muscle groups. All right. Then we have the intra-abdominal abscess. This one, for example, we have what peritoneal abscess. This one is in the abdominal cavity. We have the retroperitoneal abscess. This one is what behind the peritoneum. Then we have intra-organ abscess. This one is abscess within organs like what liver, spleen, kidneys, and the rest. Okay. Then thoracic abscess. Thoracic abscess, this one is abscess that can form in the thoracic cavity. Like for example, pleural abscess, this one is in the pleural space. We have pulmonary abscess, this one is within the lung tissue. Then we have mediastinal abscess, this one is what within the mediastinum. All right. Then we have abscesses within the central nervous system. We have cerebral abscess in the brain tissue, cerebellar abscess, this one is in the cerebellum. Then we have the spinal abscess on the spinal cord and vertebrae. Okay, these ones could be deadly because this part of the body is delicate, sterile, and all that. So you won't actually want all those abscesses in there. All right. Then abscesses could also form within the bones and joints. All right. Abscesses could form within the bones and joints. So if it is within the bones, is when we say what osteomyelitis. Right. If it is between the joints, that's where we say what arthritis or something. Okay. Then visceral abscess. This one is basically in the organs. Anything visceral is talking about organs. So you have hepatic abscess in the liver, splenic abscess in the spleen, renal abscess in the kidneys, and all that. Okay. So I think these are what a good overview or a good compilation of the anatomical classifications of abscess. See you.